What's the truth about anal sex? And how can you make sure you're doing it safely? I'm Dr. Emma Blake, a urologist and men's health specialist. Today we're going to talk honestly and medically about anal sex, why some people enjoy it, how to approach it safely, and what to avoid to protect your body and your health. Anal sex involves inserting the penis into the anus of a partner, and for some, it's a source of pleasure, intimacy, or simply variety. It's more common than you might think. Studies show that around 37% of men and 30% of women have tried anal intercourse, and about 10% of sexually active women engage in it regularly. Some couples use it to avoid pregnancy, others enjoy the unique sensation, and some find it strengthens trust and connection. And no, this isn't new. Anal sex has been depicted in art and writing since at least 300 AD, from Peruvian pottery to 19th century French lithographs. This part of human sexuality has a long and varied history. So let's address the big question. Is anal sex safe? Yes. When done with communication, consent, and care, anal sex can be both safe and enjoyable. But there are key things you need to know first. Unlike the vagina, the anus doesn't produce its own lubrication. That means using a generous amount of lube is essential. Water-based lubricants are typically preferred because they're pH balanced for the rectal lining and safe to use with condoms. Silicone lubes last longer, but they can be harder to clean off. You may need to reapply during sex. Don't be shy about stopping to add more. Now, you might be wondering, why a condom if there's no risk of pregnancy? Great question. The answer is STIs. The rectal lining is delicate and tears more easily, making it more vulnerable to sexually transmitted infections like HIV, HPV, syphilis, chlamydia, and gonorrhea. Condoms, especially those FDA approved for anal sex, are your best line of defense. You can also use dental dams for oral to anal contact. And always remember, if you switch from anal to vaginal sex, change the condom. It's not just about hygiene. It's about preventing bacterial transfer, which can cause infections. What about toys? Start small. A lubricated finger or a small anal toy is a great way to explore comfortably. Just make sure any toy you use has a flared base. That wide base prevents it from accidentally slipping too far inside, which could lead to an unwanted trip to the emergency room. Never use objects not designed for anal play. And always clean your toys thoroughly after each use with warm water and toy-safe cleaner. If you ever feel pain, stop. If there's significant bleeding, burning, or lingering discomfort, listen to your body. While rare, aggressive, or unlubricated anal sex can injure the anal sphincter, the muscle ring that controls bowel movements. Damaging it could lead to complications like fecal incontinence. Again, rare, but worth avoiding with good technique and care. To sum up, communication, consent, plenty of lubrication, barrier protection, and the right equipment are the key pillars of safe and enjoyable anal sex. When done right, it can be a positive and intimate experience between consenting partners. And before we wrap up, if you're looking to support your testosterone levels, sexual energy, and performance naturally, I recommend checking out the supplement I've linked in the pinned comment. It's a blend of clinically backed herbs and nutrients designed to help men optimize hormone health, stamina, and recovery, without synthetic hormones or risky side effects. My patients love it, and many have noticed a real difference. Stay healthy, stay informed, and take care of your body, because you're worth it. Dr. Emma Blake.